Let's talk about the core differences between heparin and warfarin. Both of these have the same medication class. They are both anticoagulants. Warfarin is the generic name, but the trade name is Coumadin, where heparin doesn't have a trade name. But we do have a suffix like parin. You'll see this in enoxaparin, which is a low molecular weight heparin. Okay, next is the antidotes. The antidote for warfarin is vitamin K. You can remember this by the memory trick. During war, vitamin K kills warfarin. And the antidote for heparin is protamine sulfate. You can remember this by the memory trick. You will need help from a pro to stop bleeding out. Heparin and protamine. Next is the mechanism of action. Warfarin inhibits production of vitamin K, where heparin inhibits formation of fibrin clots. Now let's look at the routes they're given. Warfarin is given PO or by mouth. Heparin is given IV or sub-Q. Heparin is inactivated by gastric acids in the stomach, so it can't be given orally. Now for the side effects. Both of them have one very serious side effect, which is the risk for bleeding, being that these are both anticoagulants. Now let's look at the therapeutic uses. Warfarin is best for long-term therapy, where heparin is best for short-term therapy. You can remember this by the memory trick. Warfarin, you have to wait. The onset is really slow, making it best for long-term therapy. Where heparin happens fast. The onset of heparin is really quick, making it good for short-term therapy. Now let's look at some patient teaching. The first one is for warfarin. Vitamin K intake needs to be consistent while on this medication. And for heparin, after administration, pain, irritation, and bruising is normal and common. Lastly are some nursing considerations. Warfarin is measured with INR. This is a blood test to measure the effectiveness of warfarin. You can remember this by the memory trick. The end of warfarin actually spells out INR in a jumbled way. And heparin is measured with the blood test APTT. You can remember this by the memory trick. If you hold out all of your hands, it spells out heparin PTT. That's all for warfarin versus heparin. If you're looking for new ways to study in nursing school, laminated templates are the best. They're pretty much like a mini whiteboard that you can carry around. You can find these on my shop, Nurse in the Making. Happy studying, future nurses.